The tummy button, of course, is a vital part of when you were in your mum's tummy, right? And the way I explain it is that if you have your dad and your mum come together, form the zygote, then as this point, as the growth starts, every bit of the body is got memory. The message for every bit of the body is right there. Then it grows apart and grows and grows and grows, and each one of these messages grows into an organ. All right, but this point here, I think, is as close as I can get to that moment of conception.
Right.
So at that point, your DNA is presumably the best it's ever been.
Yeah.
Okay. The guide tube, and I work my way from the umbilicus down.
Right.
Testing strong.
Okay.
So I do test, 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 all strong. This is good. And then where we need to go, the muscle will change and unlock.
Right.
Right. That's better than weak, 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 strong.
Right.
It's better to always, when you're testing a list of things, like going down a list of what they're allergic to, for instance, they're all strong apart from, oh, that one changed to weak. That one. That's the better way to test.
Okay.
Okay. So, these are all strong. I'm testing here all the time, and it goes there. Okay. So then I say, is it here? Yep. 100% right. Anywhere else? No.
Okay.
There. Okay. Now this isn't like ordinary needling because you shouldn't really feel anything.
Okay.
Sometimes you do, and I can explain that later. So what you do is you're just going until the needle bounces. It doesn't particularly want to go any more than that.
No. Okay. So is that just a gentle?
Just a gentle.
Yeah.
Yeah. You're not holding the needle and, you know.
Yeah.
Just.
Yeah, so nice kind of fluid
That's
movement.
right. Yeah, that's right. And then the simplest method, since then I have discovered another method because I've had 2 patients now where even this didn't work after a while. So with that, there's a separate technique, but it always starts this way with that one needle.
Yeah.
But this one is from as close as you can get, really, inside the navel, but pointing away from the navel.
Right.
So I'm testing here. So there, 2, 4, 6, 8, 10, and we're in the middle. Yeah, we're in the middle. Okay, and now we're trying to aim towards the point of the first needle.
Oh, okay.
Okay, there. So oblique, in other words.
Yeah.
Is that all right?
Yeah.
Okay. So this has served me well for forever since I discovered this technique, and just doing this will eventually get rid of the jab scores.
Okay.
But we can do a bit more than that.
Yeah.
And one thing was, I want to say, when even this one isn't strong enough, I would do these oblique needles on each north, south, east, west, 4 of them.
Yeah.
So it reinforces that first needle.
Yeah.
Okay.
Okay.
Right.
Yeah, so it's supporting from every angle sort of thing.
Coming in
Yeah.
in like that. That's right.
Okay.
So that's simple to do on yourself. See? Right. Now, next thing I ask, is there a particular organ to do here? Yes, it's 2, 4, 6, 8, 10. Right. So you find the organ, you can have a list of organs and go down the list. I prefer to do it like a 5-element because that was my original.
Yes, okay.
But in this 5-element, the John Bike, who brought over, you know John?
Yes.
I've done a few of his courses.
Yeah.
Because when I learnt, they put fire at the top.
Right.
But John says, oh, we don't do that now.
Oh,
we put wood at the top.
Okay.
Right? And I think it probably doesn't matter.
Okay.
As long as you've got in your mind what you want.
Yes. Yeah.
Right? I think that's the whole secret with muscle testing
Okay.
and acupuncture.
Yeah. The intention.
I have to admit, I have done the wrong point by mistake. For 40 years,
Yes.
you
Yes,
do
it
occasionally, don't you?
happens,
Yeah.
Yes.
But because I was thinking of this other point,
Yes.
I still got the exact
Yes.
same pulse change that I wanted. so I think intention is everything.
Yes. Yeah. When you're in that field, yeah, absolutely.
Yeah. Right, so again, we're testing a list, so we're testing strong.
Okay.
So, and what I actually do is this in practice. I test, because these are the 5 elements around here,
Yeah.
but I come right off and test there just to make
Oh,
sure that
okay.
this arm is working.
Like get a control.
And then
Yeah.
I go to the centre, because in the centre there's a 6th element,
Oh.
according to the body when I ask,
Yeah.
which is central control pillar, which is like Ren and Do.
Right.
Similar, but
Yeah.
different really.
Okay.
Okay, so this is strong here, and that's strong there. So that's wood, fire, earth, metal, is it anything else? No, I thought it was going to go on metal, and that's kidney. Oh, that's gone. Right,
Oh,
kidney.
I wouldn't have predicted that.
No, I know, but in fact, what we're dealing with here is DNA,
Yeah.
right?
Jing.
And the Jing, exactly right.
Mm.
And I have to be honest, kidney comes up nearly every time.
Yeah, it makes sense, doesn't it?
Yeah.
Yeah.
Right. So next thing we need to know is it kidney excess or deficient?
Yeah.
Now I was taught you can never have a deficient kidney, right? I think you can. And what are we dealing with here? Excess. 2, 4, 6, 8, 10. Deficient. Right. Excess kidney is always on this side,
Right.
on the right hand side.
Okay.
Yesterday I had a bladder patient and I wanted to treat bladder. And okay, it did give me a bladder point somewhere down just under Ren 7 somewhere. But I also realised that if you treat an excess kidney, its partner bladder will be deficient. If you have a deficient kidney, its partner bladder will be excess. Same with every element.
Yeah.
So that could be that we're treating, well, we are treating more than one thing at a time here. Okay. Now kidney excess starts here. I've got a map of this. I don't know if you've seen it. Are you in my Facebook group? Muscle
No.
testing. Okay, because you can download all this on
Okay.
there. I'll show you the map in a minute. So that's in this region, and I'll keep going until I get a change, which is there. 2, 4, 6, 8, 10. Anything else? Right. Okay, there. Right. Now I say, is there a line coming off that point? That's excess kidney. But there is a line. Which way is it going? Somewhere over here. What happens is, you see, this little message that grows into the kidney comes out from the umbilicus, the navel, and works its way towards the kidney.
Oh.
And you can sort of trace it.
Yeah. Okay.
Okay, so I put until I get a change, which is there, anywhere up there, 2, 4, 6, 10, right. So I tested all strong, change. So it's along that line.
Okay.
Then work along that line, strong, change, that point. And then, is this the point? Yeah. Okay.
Yeah.
So lots and lots of double checking.
Yeah.
Is there a glitch? Yes. From here? Alright. A glitch is when instead of a nice straight line, you get a zigzag.
Okay.
Okay. So just go that way, this way. So I go turn until it changes, which is there. Come out. Till it changes. There. 2, 4, 6, 8, 10. Now on the glitches, that's the only place so far that you might feel something.
Okay.
Okay. Not all, you don't often, but when you do, it's usually on a glitch.
No.
Good.
Nothing's
Okay.
Yeah.
Now, are we back on track? Back on track. So This is coming here, there, here, there. 2, 4, 6, 8, 10. Right. So you've got a one needle glitch this way, and then to tell the body this is what we want fixing, body. Do a correction needle. That's coming this way. So in that V, we go the other way. I'll draw it out in a second. There, can I put that? Okay. That's what I call a correction needle. This is lip liner or eyeliner or something like that. Great fun buying these from them. Just draw a line. That's where it goes. That's where it goes. And a couple of dots showing that that's the correction needle. Right.
Okay.
What does she need now? Does she need something else first? Yes, okay. What does she need? Does she need an organ here? An organ eye? No. What have we got? We've got thyroid, eyes, perimenopausal blood. Blood went thing. On what level? Deep level. So are we doing this type of thing? Right. I find that after the jab, there's a pandemic of B12 deficiency.
Okay.
Blood,
Yeah.
basically.
Yeah.
And women, of course, blood machines.
Yeah.
And in fact, that's what I got it as well after I caught caught COVID in the past, and then I developed B12 deficiency because I haven't had a jab. So I asked for treatment for that, and it's like this. But in fact, this treatment is so deep, right, very soon after this point, that it treats everything.
Oh wow. Brilliant.
And it does it on the central control panel. So I'm testing, change there, 2, 4, 6, 10, anything else? Right. Straight line, anything else? Right. Can I move that? Okay. Any more? No, okay. So now how much have I done? Needling. 50, at least 50%. 60, 70, 80, 90, 100, any more? Right, so that's all the needling we need to do.
Okay.
This picture is from another patient, and where it says standard anti-jab vaccination treatment, the light coloured handled needle, the blue one, is standing up a bit too much. It should be a bit more oblique so that the 2 points of the 2 needles are as close as possible as can be. Kidney access is always on the right of the body. On the left of the body is kidney deficiency. That doesn't necessarily mean this is going to the right kidney here. It's probably going to both kidneys. So we've got 1, 2, 3 needles following the track from the kidney. The first kidney is just underneath the umbilicus and to the side, just outside the kidney channel. And then we check each needle in turn by turning the guide tube until the muscle testing changes. So that gives us the direction. Then we go along that line, testing strong until the muscle testing changes, goes weak or unlocks, and that's where we put the needle. We can also at that point say, is this the right place? Out of 10, 2, 4, 6, 8, 10, all strong. 11, which is impossible, goes weak. Okay, so we know where to put the needle. Do that with every needle. So we get 2 more, making 3 in total, going in a straight line. And usually that should carry on in a straight line, but this one deviates. I call it a glitch. And it's quite a steep glitch. This one is 1, 2, 3 needles off, which is quite a long way. Often it's only 1 needle off, and it's a fairly steep angle as well. off the 180 degrees, that's something like 70 degrees. Okay, so we follow each needle, testing to see where it goes. So that's the next three needles in the glitch deviation, it's labelled. And then the last one is back on track. So we turn the guide tube, turn until the muscle changes, then along that line until the muscle changes, and find that we are back where we should be if the line had been straight and not glitched. So put that one in and draw that zigzaggy line to make it clear what you're doing, and then we can do a correction needle. I used to do, because there were 3 glitched needles, I used to do 3 correction needles, but I don't think that's necessary nowadays. I think the one will do in the middle of the 3. So same again, we're testing everything to see where it comes.